Hello and welcome back to A Better World. This is your host Mitchell J. Rabin, and we're very glad that you're joining us again today. Today we're going to have another very interesting show. We have a very special woman with us who is a holistic hygienist, dental hygienist, Zelaya. She's been in practice in New York for many years. She's actually very well known and has been interviewed many times on radio and WBAI and other stations because there are very few people who are doing in this world what she is doing. She has brought the wisdom of holistic thinking and nutrition to bear on the dental world. And she'll be speaking with us about what that means, what the implications are, and the way healing takes place of your gums, of your teeth, through the use of nutrition and holistic thinking. We've been wanting to have Luz on the show for quite some time, so we're very glad that she found the time to come into the studio and talk with us about her work.
Hi, Mitchell.
Hello,
nice to be
Luz.
together.
A pleasure.
Good to see you.
Es un placer.
Yeah, finally made it.
Yes, finally, exactly. So glad to have you, Luz. Really. So why don't you tell us first by just defining what holistic dental hygiene is for those people who may not know.
The best way to really make clear what holistic dental hygiene is to make the differentiation between conventional and holistic. And as we may all know that conventional dentistry approaches periodontal disease by incorporating into the therapies antibiotics, surgery, and chemical solutions.
Yes, yes.
The difference, and very specifically, is that
people
you address
almost get poisoned.
Exactly. Unfortunately,
hate
yeah.
to say it, but it's just
it's the truth.
true,
right?
isn't it?
Unfortunately, yeah.
And you've seen it in your position,
right.
haven't you? I mean,
Yes.
you've seen people come with damage.
Right. And the problem with that is that they address in symptoms. So the patient is merely married to the dentist. They keep coming back because the symptoms are not eliminated. Or
because it's really only a partial
right.
fix.
It's masking symptoms and not addressing the cause.
Right.
The difference is that in the holistic approach, you indeed view the whole body. The whole body is one whole organism. And when you view it like that, you look at the causes. And periodontal disease, which is a degenerative condition, is an infection of the gums. And degenerative condition means that the bone actually gets dissolved. I mean, people get severe bone loss. Is that what
periodontal condition means?
Yeah,
it means a dissolution of the bone?
Exactly, and the connective tissue, which is gums. The
I
gums
see.
And the fibers that are holding gum bone and tooth together for cushioning and support. So the other problem, I won't get too lost on the explanation of the perio, and I'll come back to the differentiation of the conventional, the holistic.
Right.
The thing about perio, unfortunately, is that it's usually asymptomatic, so the patient doesn't feel any pain. The pain goes to the clinician, the dentist, the dental hygienist, and if the early stages of periodontal conditions are not recognized, the patient thinks she is fine. And it's a very...
Is it visible?
Absolutely, absolutely, because you could see when you know dental anatomy and you clean in the teeth, you go with the scaler into the spaces between gum and tooth, which is where the bacterial plaque harbors. And when you know the anatomy, you know that it should be from 0 to 3 millimeters, the space, but when it's beginning to become 5 and 7, then there's something to be aware of and to caution the patient that something is not right.
Yes.
That's the beauty of...
That's your indication of a serious problem.
Yeah, definitely. And the patient is not even aware. The other part is that the beauty in what I do is that it's not only that by approaching it in a holistic manner, you get the result, the positive result, because you got to the cause, and also that not only the patient gets oral health, but general, because the body is all connected. So the difference is that when you have the conventional approach, you'll get antibiotic, you'll get a surgery suggested. Let's say the patient goes through the surgery and the patient thinks it's fine, everything's fine. 3 months later, the dentist may recommend surgery again. Why? Because the cause was not addressed.
What are they going to take out this time?
Just more gum.
Wonderful.
You're right. The beauty in what I do, which is very important to share with the audience, is that there is a cure for periodontal disease. There's no question, and I mean naturally, which is great. And how I developed this is because when the patient is lying in the chair next to me, you put your whole heart into it and you listen to your inner self. We call it intuition.
Right.
And when you see what's going on, you look at the body, you look at the eyes, look at the skin, and you know the skin also the largest cleansing organ, so you know when
Sure.
there's detrimental health going on. And the clear confirmation is when you take the instrument, when I take the instrument and I detect pockets and severe bone loss. And so one thing that comes into mind is that the way you could address this is like, where does health start? I mean, health starts with nutrition,
Yeah.
everything we put in our mouth.
I like to think that health actually begins with our attitude.
Oh,
But that's because I'm a therapist, so
but
that's the
but
way
that's-
I think.
But that's
I really
one,
believe
but
that.
that's absolutely body, mind,
And then
and
nutrition
spirit.
is one of
And
the
so
vitally important
Absolutely.
chemical aspects
because
of it.
like plants,
Biochemical.
we need air, we
Yeah.
need sun, we need water, we need all the good nutrients.
Utterly true.
So when I have a patient, what I have come up with, I have created this concrete program that has gotten me absolutely wonderful results. And that is that if you have, for instance,
And your clients.
yeah. For instance, a very specific and simple symptom, right? If you have inflammation of the gums, bleeding gums, people should know that it's a very, very clear and direct correlation to deficiency of vitamin C. Because vitamin C, for instance, is known for couple of things other than others, of course, but two main ones when it comes to oral health is that it's a free radical scavenger, so it purifies the blood. And secondly, without enough vitamin C in the system, you cannot synthesize or make collagen. And collagen is the protein that binds and holds connective tissue together. Connective tissue or gum tissue, facial muscles, and muscles in general. So right there, bingo. You ask the
Wow.
patient, how much vitamin C are you taking? And they may say 500 milligrams, or they may just say, oh, I'm taking a lot. So I'm very specific, and I said, well,
Yeah.
give me a number.
How much is a lot?
Right. And they think that taking 1,000 is a lot. So my line is 1,000 milligrams of vitamin C is perfect for a 7-year-old in this environment. Because it's not only the food,
really?
it's the stress-related factors, and also the depleted food, everything. The stress depletes the immune system. We all know that.
Of course.
And so you have an adult here taking, we're all the bombarding. They have to go here, they have to rush there, they have to grab something to eat, and,
Sure.
and they get.
We lead very hectic lives in New York.
Exactly.
Very hectic lives. And what you're really saying, if I may interpret a little bit, is that it shows up in the gums. It shows up in the life of the mouth, of the teeth.
Absolutely.
And it is a mirror.
Exactly. I always say the mouth is the window to the body. And the other thing that, without separating what I was saying before, is that the immediate thing I do is I tell patients, depending on the individual, of course, I may say take 3,000 milligrams of vitamin C twice a day. I may say two, 3 times, however I may break it down. But that in itself is going to be a great help to go towards the healing process.
To systemic bodily health.
Exactly. And then you have, of course, the next thing with periodontal disease is severe bone loss. People are under the notion that because it's in the mouth and they've been told that without surgery that you can save your teeth, they cannot regenerate bone, which is it's a shame because so many people go on in life losing their teeth. And it's very simple.
No es verdad.
No es verdad. It's not true.
I have to practice. She's bilingual, by the way, so for any of you for whom that applies.
So if you take one individual into consideration, what they do, and what sex is and what age group, because let's say, for instance, you have a woman in their 40s and they're beginning to go into the hormonal change. So you have to take into consideration the hormonal balance, because if you give the patient tons of nutrients, you modify the diet, and you put them through an intestinal detoxification, that's part of the puzzle. But when you really look at the other aspect, if it's a woman, a middle-aged woman, and don't look at me, by the way, is that
You don't qualify.
Yeah, right. I don't qualify. So the point is that you look at the hormonal balance, and then you know that the hormonal balance, if it's not addressed, the patient's bound to lose bone. So the calcium supplement, of course, is a must, but you have to take into consideration if it's a woman that age, what they do, what they drink, if they drink too much alcohol, caffeine leaches the minerals out of the system. So it's a whole component of those various factors that makes the concrete program that is effective indeed. Because when you attack all the corners of the puzzle, then you have a concrete program. And I can say that because I get wonderful results in regenerating bone and also reversing cavities. Reversing cavities doesn't mean that the tooth is going to get filled where the hole is, but the condition where the layer of the cavity is becomes calcified and the condition doesn't progress. If you look at the cavity, the way the cavity is, and I'm jumping, but it's the same thing because it's mineral deficiencies, mineral demineralization, is that when you have a cavity, basically the cavity forms only because the tooth was weakened due to a chronic demineralization.
Oh.
And also that the secondary factors, they're not really playing a real role. You know, you got to look at the primary
factors.
Such
as what?
Systemic. The systemic factors are the real factors.
What would you call a secondary factor?
Bacteria, like the patient not flossing properly or eating candy,
I
blah,
see.
blah. Those are secondary factors because if there are people who can eat candy, but because they have so much well-balanced minerals in their diet, and I'm not suggesting by all means that they
to
eat
eat
sugar,
candy,
but they do sometimes, and they
However,
don't just get a cavity because the tooth was not weakened.
What you're really saying, Luz, is that your approach builds immune function.
Absolutely.
And when people have a properly functioning immune system, their body, including their mouth and their teeth, live well and can sustain any amount of stressors, actually.
Correct. That's
so you're really, when people come to you, and I know because I have come to you, our whole bodies get healthier from the nutritional regimen.
Right.
And your other recommendations.
Right.
This is very important. I mean, this is a major distinction between what you're doing, and which is really why I wanted to have you on the show and show people what it is that exists and what you're doing, so they don't have to go with the standard conventional treatments, because that actually toxifies the system. If you look at antibiotics, all it does is tax the system.
Absolutely.
Now, it doesn't mean that there isn't a place for antibiotics.
For emergencies.
Exactly. There is a place in our lives. I mean, however, if the higher our immune function, the less the need for that.
Exactly.
And just the better life you've got.
And the more that you can withstand all the stress, whether it's from being in the wrong place, at the speed of the pace that we live in.
Sleeping too little, eating poorly, even.
And the other thing that I wanted to say is that it's very important to people to know that when you have your immune function, it's repeating what you're saying, but just know it, because when you go to the dentist, when the dentist is now informed in this field or in the natural field or the holistic field, they will always tell you, you have to do root canal, you have to have surgery, you have to have antibiotics. And people have to know that when you address your immune function naturally, it will heal and regenerate. And they should know that. And the way I'm stressing it is because when you go to the dentist or you go to the medical doctor and you feel like all vulnerable there, and this is authoritative figure with a white lab coat, and you're saying, I don't know anything, I'm in his hands. Know it. That's why I always tell patients, ultimately, you're responsible for your health. You have to inform yourself. You have to go get books, talking about books, how do I get into this field? What led me to this approach?
I would have loved to ask you the question.
Yeah, well, because when I was a dental assistant, I worked in one place for 10 years. And I never did things like a bird. You know, I paid attention to my surroundings and what they did, and always trying to learn. Well, basically, I learned what not to do. And it showed me the whole the whole conventional way.
Right.
So then I said
what to avoid.
When I became licensed, that I started treating those very patients, I would look at the chart, I would look at the x-ray, I would look at the patient. This patient started coming here 15 years ago, 20 years ago. This patient had 32 teeth, and she's been coming like every 3 months, every 4 months. And now the patient has like 20 teeth left. And I'm saying, this patient came to the so-called expert on the field, and I came up with a line saying, well, the patients were paying for supervised neglect. And I don't mean to be harsh, but the point is that just to, again, enlighten.
It's not always, but it's often the case.
Exactly, because we are ultimately responsible for our health. So that led me to question the conventional approach.
Setup.
I mean, if they come in school, they tell you it's all about bacteria. Everybody produces bacteria, not everybody has periodontal disease. So then
Sure.
I started researching, and guess which book I found first? And that was my reinforcement, and after that, nobody could take me the other way.
What?
Dr. Weston Price's book. And his book is Nutrition for Physical Degeneration. And Dr. Weston Price was a dentist from Cleveland, Ohio, who was a very caring dentist, and started noticing that some patients developed oral diseases and some didn't. This is from the 30s and 40s. And he got curious, and so he left his practice and went to study health. He went to South America, New Zealand, South Africa, and found that the people that were eating the organic foods were not having oral diseases. It was the people who were eating the refined processed
Sugars,
food,
carbohydrates,
right,
etc.
or the processed food.
Processed food.
And it was very interesting to look at the pictures of also how affected the occlusion, the way the teeth meet, the top and bottom teeth, and how the people have to have braces when they have malnutrition, when they haven't been breastfed 2 years, which is really the ideal way to go with the infancy. With the babies, the infancy years, to give them a real good start, because people talk about that if you nurse babies, that they're going to have a great immune function, they're not going to have allergies.
Right.
But that's part of the equation. The other part is that the developmental process of the jaw, and also how the tongue swallow. When you swallow normal, the tongue goes up to the soft palate, but when you bottle feed in a baby, they swallow forward as the fear of choking on the floor, so it throws the occlusion off.
Oh, interesting.
And that's how the teeth are all over the place. Wow. And so then from
that's
there
a very subtle, not well-known point.
And those books should be in every dental office.
It should be.
Yeah. But
let me ask you, because we're starting to head out of time, and I think that a few points that I really want the audience to hear about from a holistic point of view. Like you mentioned root canals.
Right.
It is very much part of our culture to think that if a certain nerve damage occurs in the mouth, that root canal is the only answer. Could you speak to that and say what has gone on with your patients?
The root canal therapy is a treatment that I don't know, I call it lucrative treatment. And because, as I said before, when you give, please remember, because I always tell my patients, and I said, remember, this is confidential, by the way, because the ADA would hang me high.
Right. But it's confidential. We're telling thousands of people.
But that's confidential.
Between us.
The point being is that when you have a toothache, please remember that given the body the natural support, it will heal and regenerate. Please remember that. So in any situation, it's the healing that really counts, not the masking the symptoms for the pain.
So in short, you're saying that root canals are not necessary.
And not health conducive.
Certainly not. And they can lead to untold other problems. But basically you are saying that there are alternatives to root canals.
Absolutely.
And when people come to you, you walk them through what to do, the process.
Yeah.
Okay.
Yeah.
That's just a really important piece of the whole thing.
Yeah.
Now there is something, as you will know, called biological dentistry, which is a slowly but surely growing field, which is very interesting because it refers to the teeth as related to almost like acupuncture points or reflexology points relates to the rest of the body.
Yeah.
What do you think of that?
I think that's great because the point of biological dentistry is that they give you the materials that are harmonious to your system. That is the key in a nutshell.
Okay.
Because then like that you won't have reactions like allergic reactions, which will not represent symptoms like a rash or anything. It could be different types of symptoms.
Sure.
And the patient will not know that it's due to the material that they have in their mouth, which is another thing that I have to share with patients about what material they have in their mouth, what's toxic and what's health conducive.
Will you then speak to the famous subject or infamous subject of mercury?
Absolutely. Always. When I look in the mouth, I'm very tactful because I'm up against all the big guys and I have to be very, very, very cautious.
Judicious.
And I always tell patients, it's confidential. So I said, but mercury is, amalgam is really a material that should not be in the mouth. And if you went to dental schools and if you see where they store it, you'll see that it says, it has the sign of
skull
poison.
And crossbones.
Exactly, poison. And I remember that years
This
ago.
has become, of course, very, very popularized as an idea. And it's even been on 60 Minutes.
Exactly.
And they challenged the ADA.
Yeah.
And they actually left with egg on their face. It was quite embarrassing for dentists. I've spoken to dentists and they said they felt failed by the ADA and just in their recommendation that mercury be used at all.
Right, but you know it's
But
been
dentists
banned already
just follow.
it's been banned in I think in Switzerland, it's been banned I think in England as
Is that
well.
so?
Yeah, it's been banned in Switzerland, I know. Canada, you know, it's getting around.
So what would you recommend, what material would you recommend for fillings?
It's a non-metal. By all means, that's the other key word, key information that I share with patients is the best and most health conducive material in the mouth is non-metal. So there's a material that is very strong. They're making progress too, and those non-toxic material. There's a material called ceramic.
Or ceramic.
It's ceramic. It's called ceramic, but it's a combination of glass and plastic. Yeah.
I see. Wow. God. So changes are taking place.
Slowly,
They're slow.
but it's happening. It's happening.
Now, when somebody comes to your office is on East 56th Street?
54th Street.
54th Street. When people come to your office, what can they expect? What happens?
Well, thoroughness in which the way I conduct the dental cleaning, very thorough and very informative. And they come out of there knowing all the information that pertains to what they are, the symptoms that they're showing. All the symptoms that are manifesting in the mouth are being addressed. Not just like, let's do a cleaning and
send them on their way.
Very informed. It's very, very thoroughly informed. And they get written material, not just oral information, but written material. And also
they have to do some homework.
They have to read because that's the only way that you really take care of your health, by being well
You educate
informed.
them. You educate them.
You have to. And that's our job as practitioners. We have to educate patients.
Now, in our closing moments, I do want to say that as having been a patient of yours, my teeth got better and my whole health got better.
Yeah,
and I have you to thank. And
thank you.
I absolutely. And I also want to make it clear to the audience that unlike dealing with other dental professionals, when they come to Luz, there is a very kind of a personal relationship. She looks at you, as she was saying, she looks at you, she makes contact with you, she looks not just at your mouth, but at your skin, in your eyes, at your posture. There's a holistic picture. And this is so important in this day of increasing impersonality between health professionals and the patient.
Right.
And I can't tell you how thankful I am that I met you and that what it's like to be a patient of yours, because it's really actually, may I say, a joyous experience. I mean, I left leaving feeling really good.
Yeah, thank you, sweetheart.
Absolutely.
And that's what gives me pleasure when I get this feedback from patients that they say, I feel wonderful, I have more energy. Of course, because you get to give them get the puzzle in the right perspective and tell them this is no good, this is creating that. And the other thing is also by smelling the mouth. You know, you can tell if they have mucus, if they have parasites. Exactly.
Right, exactly.
So that's it's very beautiful, you know, to be able to be in that situation, to be chosen to be in this path. Because, because you're working toward helping people, humanity, rather than just doing some type of typing type of job, you know, or like the second.
Well, that has its place too.
But that's not
for
you.
That's you had a calling and you heard it,
which is great.
And you responded.
Yeah.
And we're all very glad that you did.
And I'm very thankful to the universe too, because I don't call it a job. It's wonderful when I go to work. It's wonderful because I enjoy it. I enjoy what I do, and that's why I've been gathering more and more information.
That's why you've been so successful.
Yeah.
That's why you are.
Yeah.
I just, we have literally just a few seconds. I just want to let people know that you developed an all-natural mouth rinse. Can you just, in a few seconds, share with us?
Yes, because and conventionally they have chemical solutions. So I came up with this
mouthwashes,
formula
etc.
I came up with this formula that it has golden seal, echinacea, propolis, calendula, and cayenne pepper, and apple cider vinegar, which is all destroy bacteria, and so therefore promotes healing. And it's natural, so therefore you could even swallow it. It's called Xyloral.
And I have used it.
So,
Luz, thank you so much for being on the show.
My pleasure.
Really great to have you.
Thank you for having me.
Absolutely. This is Mitchell J. Rabin for A Better World. I hope you enjoyed that as much as I did. And I look forward to seeing you all.